Hi Blood Talk fams, we are well in the flu season now, and with the pandemic that is still going on, it makes things even harder for us as healthcare providers to look after our patients. Hospitals around the world have less resources available to care for patients, as the hospital capacity is already stressed beyond the maximum capacity with COVID-19 patients. What are the similarities and differences between flu and COVID-19? Is there a way to tell the difference? What are the symptoms and complications? How do they spread, and what are the contagious period? And don't forget to stick around until the end because I will compare the common colds and flu for you. Without further ado, let us get into it. The first question is, what are the differences between the two viruses that cause flu and COVID-19? A simple answer is, flu and COVID-19 are caused by different viruses. Flu caused by influenza virus. COVID-19 is caused by a different virus called SARS-CoV-2. How can you tell the difference between flu and COVID-19? Both share some similar signs and symptoms, but to definitively tell the difference between these viruses, there are tests that laboratory can perform. The specific test must be done within the first few days of the illness for more accurate test results. Rapid influenza diagnostic tests are immunoassays that can identify the presence of influenza A and B viral nucleoproteins antigens and display the results in qualitative ways, positive versus negative. However, the gold standard still remains RT-PCRs, or reverse transcriptions polymerase chain reactions, or we can also use viral culture. However, for RT-PCR and viral culture, the downside is they take longer than the rapid influenza diagnostic test. Even though the rapid influenza test is not a gold standard, but it is much faster than the RT-PCR. How about sign and symptom of flu and COVID-19? Flu and COVID-19 are coexisting in this flu season 2020-21, and maybe in the foreseeable future as well. It is important to differentiate between them because that could lead to different costs of treatments. Flu and COVID-19 have similar symptoms, range from no symptoms or asymptomatic to severe complication. Common symptoms include fever, chill, cold, and shortness of breath, or difficult breathing, fatigue, tiredness, sore throat, runny nose or stuffy nose, muscle ache and pain, and headache. One key difference is that COVID-19 may cause you to lose sense of taste or smell, which is not common for a flu virus to cause this symptom. How long before symptoms appear? After exposures and infections. For a flu, it typically develops symptoms anywhere from 1 to 4 days after exposures or infection. For COVID-19, a person typically develops symptoms 5 days after exposure or infections, but symptoms can appear as early as 2 days or at least as 14 days after infections. Just keep in mind that there are still much to learn about COVID-19 and its behavior, so as we learn more about it, this may change. How long can someone spread the virus after contracting or after symptoms onset? For the flu, virus may be able to infect others beginning 1 day before symptoms develop, and up to 5 to 7 days after becoming sick, but they are most contagious in the first 3 to 4 days after the illness begins. And again, for COVID-19, much of it is still under study and investigation, but now we know that people can spread the virus for about 2 days before signs and symptoms shows, and remain contagious for at least 10 days after signs and symptoms appear. How does flu and COVID-19 spread? These viruses spread through close contact. Close contact defined by less than 6 feet. They mainly spread through droplets. When infected people cough, sneeze, or talk, the droplets can land into the mouth or nose or may be inhaled into the lung of another person. Other than when the droplets lands on the mucosal layer, a person can also get infected by physical human contact like a handshake or touching a surface or object that the virus has landed on, and then touch your nose or mouth or eyes. What about complications following flu and COVID-19 infections? Most of the people who infected with influenza virus and COVID-19 will recover just fine. However, for those who are less fortunate, could develop some moderate complications like sinus or ear infections. Being infected with flu and COVID-19 can result in serious complications include pneumonia, respiratory failure, acute respiratory distress syndrome, or fluid in the lungs, sepsis, cardiac injury, multiple organ failure. In addition to those complications that I just mentioned, COVID-19 can also cause blood clots in the vein and arteries of the lung, heart, legs, or brains, and can cause multisystem inflammatory syndrome in children, or MISC. Is there or are there approved treatments for these virus infections? Both flu and COVID-19 patients are receiving supportive care according to their needs and symptoms. Antiviral drugs may be given to people with flu infections who is also at a high risk of flu complications. Now, a question may come up in your mind. Can we use antiviral drugs to treat patients with COVID-19? The answer is yes. Remdesivir is an antiviral agent that is being explored as a treatment for COVID-19, but it is being used under an emergency use authorization. Blood talk fun time. Now let's compare cold and flu. A common cold and flu also have similar signs and symptoms, but are they the same or are they different? And how are they different? Well, first off, they are different because they're caused by different viruses. A common cold can be caused by different viruses like rhinovirus, coronavirus, not the same one that caused COVID-19, and parainfluenza. So for the flu caused by influenza virus, and the common ones are influenza A and influenza B. Let's compare the signs and symptoms of flu and cold. The cold symptoms are usually milder than the symptoms of flu. People with colds are more likely to have a runny nose or stuffy nose. Colds generally do not result in serious health problems. Here is a table comparing the signs and symptoms of cold and flu from CDC website. Thank you for staying with me until the end. What do you want to know next? Do you want to know more about blood bank, chemistry, microbiology? If you have any burning questions, please feel free to leave me a comment down below. Lastly, if you have not done so, please like, share, subscribe, and click the notification bell. I will see you in the next episode of Blood Talks. And as always, remember, your blood tells you the story of your health. Thanks for watching. Bye!